Good morning. As you all are joining day 2 of this year's annual summit, we are going to focus this morning on the COVID-19 pandemic, which has brought social and racial injustice and inequality to the forefront in public health. It is highlighted that health equity is still not a reality as COVID-19 has unequally affected many racial and ethnic minority groups. This morning's panel discussion will focus on the COVID-19 African American Education and Outreach Partnership. Before I introduce our panelists, I would like to share remarks by Congresswoman Barbara Lee, representing California's 9th Congressional District.
Thank you, Dr. Lee, for that very kind introduction, and thank you to the National Minority Equality Forum for inviting me to speak with you today on this so important topic. Also, thank you to all of the partners of the COVID-19 African American Education and Outreach Partnership Project, including the East Bay Community Foundation, the Congressional Black Caucus Institute, and Kaiser Permanente. We all know that systemic racism is at the heart of every crisis we face today, from the COVID-19 public health crisis disproportionately impacting communities of color to the crisis of police brutality. Black and Latinx people are dying at over twice the rate of white Americans and are dying from COVID-19 at younger ages. American Indians and Alaska Natives have also been getting infected and dying of COVID-19 at elevated rates and have been especially hard hit by the pandemic and its economic effects. Disaggregated data also shows high mortality rates within the Asian American and Pacific Islander communities. Since the onset of the pandemic, I have been working with Senator Elizabeth Warren on the inclusion of our legislation, the COVID Community Care Act, in every single COVID relief package to ensure that trusted messengers such as yourselves, community-based organizations, faith-based organizations, and nonprofits help reach communities that are historically and medically underserved. I was also proud to join Congresswoman Ayanna Pressley in introducing the Anti-Racism in Public Health Act, which will establish a National Office of Anti-Racism and Health within the CDC. In addition, as you all know, we were able to successfully secure funding to address health disparities exacerbated by the pandemic under provisions of the Biden-Harris administration's American Rescue Plan and Congress's Omnibus Relief Bill last December. And of course, I'm continuing to work with federal, state, and local public health departments, as well as community-based organizations, to ensure that the resources and assistance are being intended as we intended them to be used. We must have transparency and accountability, and the money must get to our communities. We need to bridge the gap between medically underserved communities and life-saving treatments. We need to work with communities to overcome historical injustices and combat the racist system that stands between people of color having equitable access to care. That is why the COVID-19 African American Education and Outreach Partnership Project is so crucial. Well before the federal response, our private-public partnership with the collaboration of members of the Congressional Black Caucus demonstrated the importance and effectiveness of empowering trusted messengers to disseminate accurate information and resources to our communities. We did set the standard for the federal government. We need to unify our objectives and strategies to ensure that African Americans and people of color are receiving timely and accurate information about testing, contact tracing, and vaccines. We need to uplift the work of trusted messengers like you to heal from the COVID-19 pandemic. We know the disparities witnessed during the COVID pandemic are not new. They are the result of a public health system that is a remnant of 401 years of racial oppression. Overcoming the pandemic and counteracting health disparities requires a massive partnership from Congress to community-based organizations. And so I thank you all so much for your efforts to promote equity in public health, both during this pandemic, before the pandemic, and beyond. I look forward to continuing this fight with you. Thank you again so much.
Thank you for those remarks, Congresswoman Lee. As she echoed and so eloquently stated, it all is about partnership. So today, I am so pleased to moderate this important session. And joining us this morning is Dr. Oliver Brooks. He is Chief Medical Officer and past Chief of Pediatric and Adolescent Medicine at Watts Healthcare Corporation in Los Angeles, California. Additionally, Dr. Brooks is immediate past chairman of the Community Clinic Association of Los Angeles County, a consortium of 43 community health centers in the Southern California area. He is immediate past president of the National Medical Association, or the NMA, and has held several positions within the organization. Next, we are joined by Vanessa Griddine-Jones, who serves as executive director of the Congressional Black Caucus Institute. In this role, she is responsible for leading the organization and fulfilling its mission of educating today's voters and training tomorrow's leaders. With over 20 years of legislative and international relations experience, Vanessa has served on staff for Congresswoman Sheila Jackson Lee and the late Congressman Alcee Hastings. She has also worked with several state legislatures and in the field of law. Mahvash Hassan is the project lead at East Bay Community Foundation for the COVID-19 African American Outreach Education and Outreach Partnership. She facilitates multi-stakeholder and sector collaboration in support of inclusive communities and has advised local governments, philanthropy, nonprofits, and UN agencies. Mahvash has partnered with community organizations and philanthropic organizations to develop and manage collaboratives in Muslim civic engagement and community centered capacity building, and has developed and facilitated multi sector coordination to support equity and language access, as well as immigrant civic engagement in California's communities. Last but not least is a man that needs no introduction to this summit, Dr. Gary Puckrein, the president and CEO of the National Minority Equality Forum. Good morning to you all. So I'll start off with a question really kind of setting the stage for this partnership. So, Dr. Brooks, COVID 19 has had a disproportionate impact on communities of color around the US. And in mid February, California surpassed New York with the highest numbers of COVID 19 deaths. Could you share some of your experiences as a clinician during this pandemic and the impact that this pandemic has had on your community?
Thank you very much, Ms. Lee, and I am honored to be on this panel with such distinguished guests, and thank you for the National Minority Equality Forum for hosting this event. So the first case is hit in January in Seattle, West Coast, and we knew that it was something significant, but we had no idea how significant it would be. By mid-February, the pandemic was being felt. I think what most people have to remember is that we didn't even know that there was community spread back then. It started with those people traveling from China or from internationally, or those that had symptoms. But it was around the time then where I suspected, and many of us did, that in fact there was going to be community spread. And then community spread hit. We did have very high case rates back then. And I will say that Governor Newsom did step in and make some pretty significant decisions to safer at home, shelter in place. What happened at Watts Healthcare Corporation, where I am chief medical officer, is that we were seeing patients with fever, shortness of breath, and what we were diagnosing as viral pneumonias. And we didn't know what we were seeing. Just didn't know. Then when the safer at home shelter in place hit, which was when the pandemic was really getting going, we actually had to pretty much shut down. We went from seeing close to 300 patient visits a day to maybe 30, a 90% drop off. Our staff were almost terrified because people were dying. African Americans were disproportionately being affected. I will say that I was then president of ANMA, and I actually had penned an article for the National Newspaper Publishers Association, the group of African American publishers. And I called it COVID-19 and Black People. We were just then making the association. And I started when America gets a cold, Black people get pneumonia. And I predicted, I said, I have a feeling this is going to hit Black people hard. And it did. So we had to lay off 3/4 of our staff. We had to develop the ability to have televisits. So then we transitioned into that as being our present mode operandi. And we got PPE finally. And then we had to deal with the fact that we weren't caring for our own people as it relates to routine care, preventive care, secondary care. So it has been a real journey. Then we ultimately came to this partnership with CBCF, Kaiser Family Foundation, National Minority Equality Forum, and are now working to have collaborations, partnerships, and as Barbara Lee, Representative Lee mentioned, messaging information.
Great. So I'm going to put a pin in the messaging and have some other remarks to kind of level set on where we are with this partnership. But I think the topic of messaging in particular communities of color is an important one. So next, I want to pivot over to Vanessa. Vanessa, could you share with us how the COVID-19 African American Education Outreach Partnership came about and CBCI's involvement in this effort?
Thank you, Dr. Lee and Dr. Puckrein. I'm happy to be on the panel to share in this work that we're doing. I'm going to apologize for the quality of my voice. I have allergies, so it comes across, but I hope you all can hear me clearly now. For us, our mission is to educate today's voters and to train future leaders. But that entails a lot more than just making sure that there are African Americans on campaigns and that we're out talking about voter rights, voter suppression. It's also about informing African American communities about all things that impact them. So in January, as Dr. Brooks says, when we first heard that there was a virus or a flu on the West Coast, we thought it was kind of alienated to that area. By February, we started to hear rumblings of there's something more going on. Right after the South Carolina Democratic debate in Charleston, it's like literally the day after, it seemed like the world fell apart. And so we saw that that Mayor London Breed had declared, a health state of emergency in San Francisco. And we were actually supposed to travel that week to San Francisco for one of our business conferences. And then in March, when Congress recessed, still thinking, okay, it's a little iffy, but we should probably be back in a week or so. And that didn't happen. So I haven't been back in the office since March. In April, I believe, is when Congresswoman Lee said, we've got to do something to help our African American communities because this is disproportionately impacting us. And she could see that early on, April, and as we were moving across the country, we could see that there were more and more cases. Initially, though, there was this conversation about how COVID is not really affecting African Americans. And so it went to not affecting them to being disproportionately impacted by it. So she came to us to talk about what we could do because as a auxiliary organization of the Congressional Black Caucus, we're nonprofit, and we're nonpartisan, so we can have conversations that they can't have as members of Congress. So we started having the conversation with her, and she had the conversation with East Bay Community Foundation and Kaiser, and we went through several drafts of what a project would look like that would actually have immediate impact on African American communities. And so we went through that process until probably around about October, November, because we wanted to get it right. Because we were contending with things like messaging and misinformation and people not having access, or people, saying that this is not affordable or I don't have it. Also, including in that was the fact that, we already had underlying health issues. So we were already constantly, as African Americans and people of color, just kind of in a different space. Our populations have different things to contend with. And COVID was just one more thing that we added on to the layers of that. So the project was started and we tried to identify within CBCI the areas that we thought would have less access, to healthcare and to get COVID testing, and they would be probably inundated with misinformation. So our areas focused on areas in the South and in rural communities, because again, different populations have different needs. So rural areas look different than urban areas. African American areas may look different than like Latinx areas. So we made sure that we fully covered all of those areas before we started the project. And we've been up and going since about December. And happy to have some of the CBOs that are working on the project on the call to see how this turns out for us. We think we're having a greater impact. We see that cases are going down. More people are getting tested. And then there was the vaccine. So, we also had that additional layer of overcoming hesitancy and mistrust and misinformation about the vaccine. So this is how CBCI got involved, because Congresswoman Lee told us we had to save our people. Yeah. So here we are. Thank you.
Thank you so much for that, Vanessa. And just a reminder to our attendees, if you have any questions for our panelists, please feel free to use the Q&A box, and we will address those in the Q&A segment at the end of this session. So Vanessa really kind of set the context of how this partnership really kind of formulated and some of the heavy lifts that had to happen within these communities. Mahvash, I believe you have a few slides you want to share, but you've led a number of multi-stakeholder efforts focused on minority communities. Could you share a bit about this particular partnership, the various stakeholders involved? I believe you consider this a very community-centered approach, and really talk about something that both Dr. Brooks as well as Vanessa mentioned about the importance of trusted messengers during this public health crisis.
Sure, and thanks again for having the East Bay Community Foundation join NMQF and Dr. Brooks and CBCI, and obviously Representative Barbara Lee. I do have a few slides that lay out the work of this partnership, and I'm just going to continue to share and go through the role the various partners have played. And at the core of it are really the community organizations like the Watts Healthcare Center, like community clinics, like community-based organizations. But as Vanessa and others have mentioned, it took a number of different folks, including NMQF, as well as an advertising company, and funding from Kaiser's community health team, and CBCI's really insights into what was happening in some of the communities in the South. The East Bay Community Foundation, just as how we got involved and why we got involved, is it's one of the oldest community foundations in the country. And while we're anchored in Alameda and Contra Costa County in the East Bay in California, we really have served as both regional and national partners to philanthropy in general, to donors, to corporations, and to governments as well as communities, to address structural barriers, to eliminate structural barriers, to really advance racial equity. And so this project is really at the core of the work that EPCF does in our communities, with our communities. But as you can see, a range of partners. The anchor organizations, or what we end up calling the CBOs, there's 12 anchor organizations across the United States, but they're really partnering with up to or over 30 community-based organizations. And those range from churches, different congregations across the country, to medical students, partnering really with medical schools and medical students, partnering with, really identifying whoever that trusted messenger is. Is it the barbershop around the corner? Is it the pastor who's been really serving your community for generations? And so I think that was at the core of it. But as you can see, across the country, Oakland and LA in California, but communities like Tunica County, Mississippi, Beaufort County, South Carolina, Atlanta, as well as Albany and beyond in Georgia and South Alabama that were identified by CBCI. Here's the list of all of, again, the 12 anchor organizations. But like I said, there's many, many more hyper-local community organizations. And as you can see, not all of these are FQHCs. You have community health clinics, you have the Allen Temple Baptist Church and the Samaritan Clinic that are very faith-based. So it really is a wide range. The role that EBCF has played has really been about coordinating, amplifying, and advocating. And as you said, Dr. Lee, with really community at the center of it. And it really, this partnership has allowed us to center community, but really focus on communities that are hardest hit by the pandemic. And as we've said before, focusing on the range of trusted community messengers to counter the disinformation, the ongoing disinformation, really. And one of the pieces that we've heard time and again from our CBO partners, it's less about vaccine hesitancy. It's more about really listening to the community to understand where they're at so that they're really able to make better informed decisions about their lives and their families and their communities' lives. Here's just some images of the types of the range of messaging campaigns that have been happening. We've also partnered with FEMA, some of our CBOs to set up and vaccination pilot sites. And I'm going to stop sharing. And we're constantly, actually, that's the other piece. I think the partnership with NMQF has been amazing to really understand the investment that's needed at the community level, but also in terms of data infrastructure to inform systemic change, because in the end, that's what we're really after.
Thank you so much for that, Mahvash. I really appreciate. Did you want to continue?
Stop sharing. Sorry.
Okay.
Nope.
No worries. So thank you so much, Mahvash, for sharing that important insight on this particular partnership. I really feel that you've really shared with us why this effort came about, how it's coming about, and the importance of partnership in this effort. Dr. Puckrein, I know NMQF has had its hands on a number of a number of programmatic and research efforts focused on COVID-19. One of these efforts, I believe, that you wanted to talk about today is HealthNet. And for those tuning in today, please share more information about this collaborative information and data exchange platform and how organizations like those involved in this partnership, as well as others, can use it to combat COVID.
So good morning, everyone. We were approached by Congresswoman Barbara Lee to come in and provide some evaluation as well as data backbone for this initiative. And it really was quite a learning experience for us. We did a number of calls with CBOs and listened very, very carefully to their experiences on the ground with COVID. There was tremendous variations. Some of the stories are just really amazing and heartfelt. I stand out in my mind is the Asian Health Service and the challenges, double challenges of racism and attacks that were going on in their community about the virus, as well as having to get their folks comfortable enough to come out to get tested for the virus, and then later on vaccinated. I think of the Hmong community, which, be honest, I had no experience with, but listening to the Native American Health Service that was dealing with the Hmong community who didn't have a language, a written language, I'm sorry. And so they had to use visualizations and videos and other tools. And then the stories, the disinformation, the absolute disinformation in the community, the Hmongs believing that the vaccinations were really an attempt to assassinate them, that they were going to, take the vaccine and then a year later they were going to die. That's just one example. And then down in Mississippi and Alabama, what I was struck by across all of the CBOs is that they didn't know about the therapeutics, that there were these medications that could have saved lots of lives, could have prevented hospitalizations, but they were underutilized. In fact, we went to each of the CBOs and asked them for the zip codes of their service area. And then we worked with the National Association of Infusion Centers, because these COVID therapeutics, you have to go to an infusion center in order to get them. And we mapped them against the service areas of the CBOs. And for the most part, there were no infusion centers in those communities. And so a real opportunity to save lives were lost. So we learned a lot. And based on that learning, we did a couple of things that we think will have some long-term impact. The first is we developed the COVID index. We could never understand, quite frankly, why we were not just mapping where the virus was in terms of community spread. But it is a slow moving train. You can predict it, right? And so there were no predictive tools out there that allowed communities to understand where the virus was spreading, where we were seeing the surge, so that we could not just get appropriate resources in those communities, but it could inform our messaging to reinforce: wear your mask, social distance, wash your hands, get vaccinated. And if you got COVID, there are these therapeutics that could help you. So we launched the COVID index. It's right now, if you go to covid.nmqf.us, you'll see not only we talk about the past in terms of how the virus progressed, but we're also offering some predictive analytics there as well. The other big piece was really messaging and communications. It finally settled in, at least for the National Minority Equality Forum, that we need to set up communications networks that expedite communications between our health services and our community, so that these trusted voices of these CBOs, and that's really one of their core assets, is that they are trusted voices in their community. And we needed to make sure that we could leverage, help them to leverage their voice in community by using big data analytics. If you think about Facebook and Amazon and all of those folks, they're using those analytics to drive business, but they're not really using it to drive benefit in community. And so we have developed what we call AI HealthNet. It's actually a series of microsites that if you go to myvaccine.org, for example, you'll see one of the microsites that we've developed. The long-term hope is that we'll create this common platform that will allow us to support community-based organizations with analytics that help them to target and message in their community, so that they're delivering information in their community at a time when people can actually use it. So you're going to hear a lot more about that activity. So the long story short for NMQF, and I want to thank Barbara Lee, who is always such a visionary, for bringing us in to this conversation and allowing us to learn, because we learned from the CBOs. They taught us a lot of what was happening on the ground that we would have never gotten in a peer-reviewed paper or sitting in our offices. They were touching people in community, and we learned from them how we could support them, how we could network them, and how we could build a better future by building upon this collaboration. So it really was quite an experience for us.
Thank you, Dr. Puckrein. So just a reminder for our attendees, please do place questions in the Q&A. We'll be coming up on the Q&A session in about 15 minutes or so. But one of the things I really want to discuss with all the panelists this morning is the importance of messaging and trust in communities of color. We know that there's been conversations around misinformation and disinformation, but there's also been a lot of conversations around vaccine hesitancy in communities of color. Do you feel, one, that there truly is vaccine hesitancy, or are there other issues at play?
I can speak to that. Yes, there is vaccine hesitancy, but on a more optimistic note, it is diminishing. over time. There's the studies that I've been accessing and reading show that it's due to mistrust of the government, the fact that the vaccine was developed too rapidly, and concern that African Americans are being inappropriately targeted. I would say that all three are inaccurate, but understandable. So as it relates to dealing with hesitancy, one has to look the person in the eye and accept that where they're coming from is real, and then go to where they are. This is one of those situations where there clearly is not one size fits all. Again, Kaiser Family Foundation has some excellent data that I've been seeing. And as I will say, that there's a segment of the Black community, probably around 18%, that is saying they will not get vaccinated no matter what. And then the other 82% either have been vaccinated or are kind of on the fence. So if you put your efforts into those that are on the fence, you get 82% of the African American population vaccinated, you're very close to herd immunity. So I'm very optimistic. Well, I'm saying cautiously optimistic. And in one anecdote, a close worker at my health center has been not getting vaccinated. Everyone in her family got vaccinated. And she came to me yesterday and said, I have an appointment to get the J&J vaccine, which is back on the market. And she's a female less than 50, which would put her theoretically higher risk of getting these cerebral venous thrombosis clots. But she said, the risk is low. Everyone in my family is vaccinated. I'm getting vaccinated tomorrow, Dr. Brooks. And so that was very reassuring. So I just give that as a story in terms of the direction that I see going right now. And the trusted messengers are the Blacks in the community that are respected, healthcare professionals, and to a degree, let's say celebrities. So I had been hammering to this person gently with a rubber hammer. You need to strongly consider getting vaccinated. And it happened.
That's really important, the messengers that you mentioned. Dr. Puckrein?
Yeah, I just want to talk a little bit about this trust and messaging issue. Our minority communities in this country are being targeted. They're being targeted by foreigners. They're being targeted domestically. And there is a real need to crowd out that disinformation. There's a real need for us to have trusted voices having the capacity to talk to our community, particularly in moments of crisis and emergencies. And we have to put that infrastructure in place. Again, I've mentioned just the amount of trust that are in. For example, the FQHCs, their board are made up of people from the community, and so they're incredibly trusted. We have worked closely with FQHCs in this projects and other places, and we see that trust. And so I think the moment has come, really, where we have to build a communications network that is using social media and analytics to power those trusted voices in our community and allow us to crowd out the disinformation. It is really dangerous for our community if we don't do that. And I think COVID is just an example of it. The numbers have yet to be told. But I think as we get to the hard numbers coming out, and they're starting to trickle out in the Medicare and Medicaid program, what the mortality rates were like and the hospitalization rate, it is going to be a very bad story. And we have to put infrastructure in place so it doesn't happen again.
Thank you for that. And Gary, you as well as Dr. Brooks mentioned the importance of providers in this place, and I think it's really important for those who are not familiar with federally qualified health centers or community health centers to really understand the populations that you serve. Dr. Brooks, could you share a bit about those two types of providers and the populations
So a
seen
federally
there?
qualified health center is funded by HRSA to provide care to those that are underserved. I was going to say an underserved community, but it can be urban or rural. We just happen to be urban. I would say 90% of those that we serve are Medicaid. Let's say 80% Medicaid and let's say 15% uninsured and 5% Medicare and other. So we are there. We're funded to treat those that are underserved. Um, we we have physicians and advanced practice practitioners, and importantly, healthcare nurses and ancillary staff. The patients often listen to my nurses more than they listen to me because my nurses are female, they have children, they work hard, and they relate to my nurses. So it is really important to understand when you talk about messaging and healthcare providers, it's not just the doctors, it's the whole synthesis of all of those. Dr. Puckrein mentioned, Dr. Lee, I think I'm going to mention you as Miss Lee, that's correct. Um, that 51% of our board are users by definition, by mandate. So it starts at that board level all the way down that an FQHC serves the underserved and those that are at the low end of socioeconomic status.
Thank you for that, Dr. Brooks. So as we all know, health and healthcare is not only global but local. And Mahvash, it was really great to see the depth and breadth of this partnership. In particular, I was impressed to see so many geographies, racial and ethnic groups, types of organizations involved in this particular partnership. This question is open to Mahvash as well as any of our other panelists, but given the work of this partnership, do you feel that there is a recipe or a guidance for how to do multi-stakeholder approaches, particularly in communities of color?
I think several folks have talked about it. It really is listening to the community, whether it's your board members that's made up of 51% of who you're partnering with. And once you center them, it's the community members, and we've seen this. We were in a conversation with Samaritan Clinic in Albany, Georgia yesterday, and she was talking about what it meant. She's the CEO of Samaritan Clinic, right? And she's talking about what it meant for her to get vaccinated and for her 17-year-old son, a young African-American male, to get vaccinated in Albany, Georgia. And what that process was about her education and then this young man's education, who, by the way, is working on a video that we're hoping to post for our community members, because that's what messaging is all about. Get the 17-year-old young man to tell us why he got vaccinated. And so I think it's about listening to community members, because they are able to, and we've seen this, adapt to the pandemic. It's evolved. Even this project has evolved so much since April of last year, right? And we've really listened to the CBOs on the ground to say, April 2020, this is what we needed, and April 2021, this is where we're going. So informing pandemic response, but also really informing the systemic reform that's needed. Because as Dr. Puckrein said, this is just the tip of the iceberg, and how we going to build on these community messengers and community navigators, where you have medical students at Grady who are on the phone calling up older adults in their community to talk to them about their concerns and get them the services that they need. How do you systemize that? How do you create systemic reform that's led by the community? I think that's really the answer.
Dr. Lee, I wanted to address that question as well. I think a key component to this is, as Mahvash said, listening to the community, but also understanding the cultural differences and the geographic differences between these communities, and the things that are embedded in them culturally, as well as where they're geographically located. As we said, the urban areas are different. I live in DC, the DC area. And I remember when they were offering up vaccines to CVS, and then I said, oh, okay, well, that's great. Everybody go to CVS. And then Congressman Thompson reminded me, there's no CVS in Tunica County, Mississippi, Vanessa. There's no local drugstore that you're going to run to get a vaccine. And so I was like, really? And I think about rural areas, you're thinking, okay, there's limited access, but basic things like a pharmacy less than 2 to 5 miles away is not something that they have access to. And so this project brought, COVID testing and vaccines to those communities. And when I went to get vaccinated, I had an older gentleman there. He had to be in his 70s or 80s. He was in tears because he was so happy to receive his first shot, because he said he had lost so many family and friends in this short period of time that he was so grateful that it was there. And I'm still battling with my family members about getting a vaccine. And, they always want to cite the Tuskegee experiment. It's like, you weren't even there. What are you talking about? And I get it. We are under attack on all sides. So I get the mistrust, but you have to weigh your alternatives. So, at least I know that being vaccinated, I'm not going to die from COVID today. We'll worry about the side effects or whatever may happen from that, but it won't be because I, didn't protect myself and my family and the community against me spreading COVID to them. So I think that's also an important message in understanding the hesitancy and then explaining it a way to get over it so that they will get vaccinated to protect the community. So I think it's understanding, listening, a passion for the work. You've got to really want to do this as well. It can't be something you're just doing to check the box because the government says you should, or because it's just a great idea. You really have to be invested in those areas that you're serving.
Thank you for that, Vanessa. Go ahead, Gary.
Yeah, I just want to jump in because one of the things that we thought about as we were working on this project, there was this great diversity, right? Both urban and rural and cultural, and the question was, how do we harmonize?
Mm-hmm.
Where are those points of intersection where it starts to come together? And one of the things I started to appreciate as we were working on this is, and I'm going to try to see if I can say this in a simplified way, when you start to cluster populations, bringing them together, geography starts to melt away, right? Mm-hmm. And what I mean by that is, if you remember back in the 2015 election, where people saw the panhandle of Florida going for the past administration, they knew that like communities in Minnesota and Wisconsin were going to go that way. That was for those who were into the demography, they knew that's exactly what was going to happen. We could do that. The technology is there for us to define our communities and get them information in a way in which they can use it in a timely way. And that's the power of this interaction that we are creating here. It's a learning community. I think that's mm-hmm. the most important mm-hmm. thing to bear in mind here. What we're talking about is building a learning community and helping those who have the ability to communicate in trusted voices and provide services. They're leveraged. And so I think the message that I'm going to push out to everyone is you too can be part of this partnership. This is not a closed network. We are talking about building a broad network, bringing together our community so that we can never have this again. You can't allow your community to get decimated like this with people standing on the sideline who could have done better, right? You got to say, we can't do that anymore. And so we are reaching out and saying, look, we want to partner. I think the foundation is starting to be laid. It's not permanent in the sense that we need others to come in, broaden the conversation. I think that's really the power of what this whole thing has been about.
Thank you for that. Dr. Brooks, I recognize from your bio that you are the past chairman of the Community Clinic Association of Los Angeles County. And given the impact that this pandemic has had on LA County and that consortium of 43 community health centers, what are some of those, as Dr. Puckrein mentioned, learnings, that you've gathered from your peers across LA County during this pandemic? Are there best practices, et cetera, that you've utilized?
So first of all, when I was chair, we used to meet once a month. So we started meeting once a week. So just sharing information on a more frequent basis. What Dr. Puckrein mentioned was really important was the therapeutics. So one of the clinics began doing infusions, and they were allowing us to refer patients to them to get infusions. And that was when it wasn't as well known, it wasn't as accessible. So that a basic concept of best practices of treatment, other than oxygen and prayer, the therapeutics was important. We also shared best practices as related to how to, going forward, how to set up testing centers. When I set up my testing center at Watts Healthcare Corporation, I learned from going to another center, Altamed, to see how they were doing it, and I fitted ours to theirs. And now, as relates to setting up vaccinations, I have learned from other sites in terms of how they are doing vaccinations, how they are using the system in California, my turn, dealing with the TPA, Blue Shield Promise. So just by the concept that we have here and now of partnering, collaborating, just that cross-fertilization of information has allowed our health center to better treat, and they've learned from Watts Healthcare Corporation how to manage certain areas. Telehealth, again, I think it's important to understand that beyond the pandemic and COVID, our people suffered because they weren't getting the care that they needed because they weren't going to the doctor. So we worked together to determine how best to provide telehealth services, how to get quality care in the face of a pandemic, how to deal with funding. So by working collaboratively and in cooperation and not competition, which is also important, we were able to find a path through this pandemic. And the last thing I'll say, don't forget testing, because testing is still there. And early on, one thing that people didn't really, I think, understand is African Americans had higher rates of positivity. And it wasn't because we were more infected, it's because we had to run the gauntlet to get tested. There was a study in Connecticut that showed 30% of Blacks were testing positive, 8% of whites. It's because you had to be darn near, with an oxygen level of 60 to get a test. So those disparities are not going to go away. We still need to keep up the pressure in terms of what we're doing now.
Great. So Vanessa, I want to pivot this conversation a bit, since CBCI's work really is in partnership with our members of Congress. Are there lessons learned, you feel, from this partnership that could influence future policy efforts?
I think for the most part, I would say that all of the members of the Congressional Black Caucus are very in tune and attentive to their areas. I think with this particular thing having such an impact, that members felt like they needed to get ahead of it and to make sure that there was funding available to continue to support these efforts. Congresswoman Lee mentioned the public-private partnership, and although that's hopeful, these things really should come from the government when your entire country is impacted by this. It's not something that we should have to rely on, private organizations and companies and corporations to participate in, that it should be a concern of the government to face that. And she fought really hard for that. So, I can't say that there were any particular lessons learned from CBC or from congressional members from this, because this is always what happens. Someone else has to come in as well as the government to say this is important, because Congress it's so hyper partisan at the moment that it's just hard to get anything through and hard to get real issues addressed. And I say that in the context of there still being, you know, just basic issues of gun control. I mean, you can't say that having gun control will be hurtful or harmful to the community. So, you know, it's an issue of, it's a matter of negotiating. It's a matter of language, you know, communications and trying to get people to be reasonable. And that's on both sides. I'm not making this a partisan issue. It's just on both sides. As I said, Congress itself is hyper-partisan. So you're doing a disservice to the country and to your constituents by constantly remaining in that state. But yeah, I think we are happy that Kaiser participated in the project, that they saw the need. And while I say it's a government function, you know, we are also obviously appreciative of when private organizations step up and step in and say, hey, we're going to help you address this as well.
And I'm really moved by something you said around CVS. So one of the things I've noted, and while I'm not in a truly rural area, is that oftentimes when you go into communities of color, you don't see any pharmacies. And so it really is important to partner with CBOs. It's really important to partner with community health centers and FQHCs who serve the underserved. And so I just want to leave that there. In the last 7 minutes of this session, I want to address some of the audience questions. And so one of the questions is, can the panel please comment on the engagement of CHC health professionals in national clinical research data on COVID-19 data collection, interpretation, and communication back to the community?
That is definitely a Dr. Puckrein question.
About the same thing.
Right, let me mute myself.
Data is everything in healthcare. It is a measurable problem, and I know, and I'm going to say this out loud. I know the members, certainly in the caucus, have put money in the budget to get data collected, particularly around the pandemic, by race and ethnicity, because the data was not being reported out. The caveat I would make is we need actionable data. Yes, you could collect data and you could put it out, but if it's not actionable, if you can't do anything with it, if it's presented in such a way that communities can't make use of it, or it is so entangled that it's hard to disentangle so you can make use of it. I think those are some of the questions that we're going to need to answer along the way. And then finally, what I would say, we also need to have numbers outside of government in order to monitor, to watch. I just think that that's important. We have to, you have to say it out loud, which is that not everybody's operating in our interest. Unfortunately, that's a very difficult thing to say, but it is in fact so. And administrations change and they do different things and whatever happens. But the point of the matter is, we're now in a place, and I'm going to speak 2 seconds from the African-American experience. And I realize each community has their own journey here, but here's the African-American experience. It wasn't until 1965, right, that we actually came into the marketplace with the opportunity to build our own community, to have a voice in the community in which we wanted to live. And we're living in that moment in which we're trying to build sustainable, healthy communities. And part of that is healthcare. And in order to do that, we have to have the data. We have to have the information, be it COVID or diabetes or asthma or sickle cell or whatever it is. We need that data. And then we need to take that data and put it into bites of information that our community can use at a moment when they need it. And we don't just put them in peer-reviewed journals. The information has to be translated and made available to folks in our community so that at the moment they need it, it's at hand. And I think that's where the challenge lies. And so we will continue to advise and encourage the members because I think they're on the right path in terms of making data available. But we have to make sure that that data is in the public interest, that it's available so that the public can use it and use it to manage their lives.
Thank you for that, Dr. Puckrein. In these last 3 minutes, I want to do a nice little round robin. Any closing remarks that any of our panelists would like to share with our attendees?
Okay,
Let's
well,
start with you, Dr. Brooks.
the momentum going. Yeah, I think that we're at an inflection point, and I've felt that for about the last 6 months. Speaking to minority participation in clinical trials, we were 10% of the vaccine trials generally across the board. That was magnitudes higher than we generally are. The top books on the bestseller list are dealing with racism. We are having groups like this coming together. We have to not lose the momentum that we have now. I think it is crucially important. Representative Lee is looking toward ultimately having legislation coming out of the work that we're doing now. So we cannot rest on our laurels. We're not to herd immunity. So what I will say is keep up the fight, be optimistic, but be diligent in terms of keeping on the pressure and have your eye on the prize.
Great. Mahvash?
I think I've said it a few times, but I'll say it again. It's really let the community lead. And informed with data, certainly, Dr. Puckrein, because if I have data about what's going on in my community, I'm better able to lead in my community. But just really let the community lead and figure out how to sustain it, whether it's through the Community Care Act, COVID Community Care Act, or through public and private partnerships. I think as the philanthropic backbone of this project, the East Bay Community Foundation is very committed to how can we sustain this in terms of the pandemic and beyond.
Thank you. Vanessa?
Myself, sorry, thank you. I would say, as we're closing, I think we focus a lot on, making sure that we're fighting disinformation and misinformation, and about hesitancy. So I think going forward, instead of focusing on reasons why we don't, let's focus on reasons why we do. And let's spread that message throughout the community. So maybe that will take precedent over the messages of all the reasons why we shouldn't, can't, and won't.
Great message. And finally, Dr. Puckrein?
I just want to say thank you. It's been a privilege working with CBOs, federally qualified health systems, East Bay, Vanessa. We've learned so much and have grown so much as an organization through the partnerships. Sometimes you can become an armchair scholar and you sit there and you think you know something, but it's really important to get in touch with community, as Mahvash has said, and understand exactly what's happening on the ground. And this partnership has really given us this opportunity. And I just want to say thank you to all of the CBOs who've taken their time. We call them up on the phone, and they're trying to vaccinate, they're trying to do the test, and all of the other things that they're doing. And we beg them for a little bit of their time so that we can learn. And we've been so appreciative of the opportunity that they've given us. And I want to just say thank you.
I want to thank this amazing panel, and I am today gonna take a page from the book that Vanessa, as well as Dr. Brooks and others have mentioned, and I have my second vaccine appointment this afternoon, and I will be putting that on social media to help encourage my peers to get vaccinated. So do your part to help to combat COVID. And with that, I want to thank you all. The next session will begin on clinical trials from the ground up. Thank you.
Thank you.
Thank you.
Bye-bye.